Taufik Abimbola Ajilesoro, a member representing Ife Federal Constituency in Osun State. Mr. Speaker, I'm from the source. I rise under our rules under 8-4, matters of urgent public importance.
Can you correct? Are you sure?
Yeah, very.
You have not been in the chamber for quite some time.
Okay. Mr. Speaker, under 8-5-2. Matter of urgent public importance, and I crave indulgence of Mr. Speaker and the entire House for us to step down our relevant rules for me to move this motion out. I so move, Mr. Speaker. I still remain Honorable Taufik Abimbola Ajilesoro, member representing Ife Federal Constituency in Osun State. I'm from the source, Mr. Speaker. Motions of matter of urgent national public importance, and is about urgent need by the federal government to intervene in the sack of 2,054 genuinely recruited staff of Obafemi Awolowo.
Order, please. Order.
Teaching Hospital OAUTHC Ile-Ife, Osun State. The House note that in 2022, Obafemi Awolowo University Teaching Hospital Management, upon approval for recruitment, embarked on a recruitment exercise. After the completion of the selection process, successful applicants totaling to 2,054, which cut across the 6 geopolitical zones, were issued letters of appointment and posted to various departments and units of the institution by the management. The House also noted that acceptance letters were required from each of the employees and same were submitted to the management of the institution within the stipulated time. Also, files and files numbers were created for each of the employees. House also aware that between 2023 and
Order in the House, please. Order.
Between July 2023 and November 2023, the Federal Ministry of Health and the management of the institution conducted 3 different levels of verification exercise for the staff in expectation of capturing an enrollment into the Integrated Payroll and Personnel Information System (IPPIS) platform for the payment of salaries and monthly emoluments. The House also aware that the issuance of appointment letters to these workers signifies a contract which is currently being negated and also represents grave injustice to the affected person, which some of them have relocated their families and dependents to their present place of work. The House is concerned that these newly employed workers have made a lot of financial commitments during the documentation process, as the workers were required to pay for medical certificate of fitness and some other levies, which got in variation of about 35,000 naira to 50,000 naira from the post of newly employed staff. And this money paid directly to the account of the hospital management. Also, the affected workers have been exposed to occupational hazard within the hospital environment without the corresponding emolument over the last 14 months. The tragic loss of life serves as a stark reminder of the gravity of the situation at hand. The recent passing of Mrs. Ajayi, a nurse whose non-payment of salaries compounded our already challenging circumstances. The House also concerned that while the staff were clamoring for the payment of their salaries and delay in capturing the management, made the pronouncement of their sack, claiming that the approval given in 2022 was not up to what they employed that time. The House now worried that if urgent measures are not taken to rescue the helpless workers of Obafemi Awolowo University Teaching Hospital OAUTHC Ile-Ife, it could lead to a coerce and breakdown of law and order within the institutions. It took the intervention of the Kábíyèsí Ọọ̀ni of Ife, Ọba Adéyẹyè Ẹnìtàn Ògúnwùsì Ọ̀jájá II, when the affected workers embarked on massive protest before normalcy could return to the institution. The House now resolves that the House will invite the head of the civil service of the Federal.
Order. Order. Order in the House. Order, please. Honorable Jaha. Honorable Alawo Akala.
The management of
Order.
Obafemi Awolowo University Teaching Hospital, representative of affected employees, and other relevant